Okay, good day everyone. Today we will be discussing herbal medicines and nutritional supplements. So the reference for our discussion is the Comprehensive Pharmacy Review for NAPLEX by Leon Shargel. So I have already sent to you the PDF of the chapter. No, this is chapter 25 in the NAPLEX Pharmacy Review. And also, I have also sent to you the concept paper for these herbal medicines and nutritional supplements. So the concept paper is just a 2-page summary of the things that you have to remember out of the almost 19 pages of this chapter. So yun ang dapat nyong malaman at saka ma-remember yung nandun sa concept paper. Okay. So for the objectives of our discussion is that after the discussion, the students would have gained knowledge on the following. So first, the regulations on herbal medicines and nutritional products. Then we have to know what drugs comes from plants, the herbs that are considered unsafe for human consumption, and the commonly used herbs. So you can see all of this in the chapter, no? So chapter 25. So first, let us go to the regulations. So what are the regulations with regards the use of drugs and herbal supplements? So the first is that the Federal Food, Drug, and Cosmetic Act of 1938 mandated pharmaceutical companies to test drugs for safety before marketing. So you know that, and you will know it further in your next subjects, that drugs, before they are being marketed, must be tested safe for human use. Then the second is the Kefauver-Harris Drug Amendments of 1962, which mandate pharmaceutical companies to test drugs for efficacy before marketing. So this is the second criteria. So the first is safety. So a drug, before it is marketed, kailangan safe to use. Second, if it is proven to be safe for human use, then we have to prove that it is also effective. So that's the Harris Drug Amendments of 1960. Okay, next to the Harris Drug Amendments of 1962, so we have the Dietary Supplement Health and Education Act of 1994, which mandated the following. First, dietary supplements are not drugs or food. They are intended to supplement the diet. So, iba yung drugs, iba yung mga dietary supplements. Hindi rin sila considered food. So, they are of different entity talaga. Next is that herbs are considered dietary supplements. So, yung mga herbs natin, they are under dietary supplements. And then, dietary supplements do not have to be standardized. So, what do we mean by this? Unlike drugs, ang ating mga supplements are not standardized. For example, ang mga drugs kasi, when we say standardized, like for 50 milligrams, 100 milligrams, so that is the standardization of our drugs. But with regards to the supplements, may it be herbs or food, hindi siya standardized in the sense that company can have or can decide as to how much of the amount ang kanilang ilagay sa kanilang formulation. So, yan siya. So, hindi siya standardized. Then, the Secretary of Health and Human Services may remove a supplement from the market only when it has been shown to be hazardous to health. So, as long na hindi proven na related talaga siya, yung isang food supplement, to cause any harm to the patient, it can stay in the market. Then, dietary supplements make claims only regarding the effects on the structure or function of the body. No claims regarding a particular disease or condition may be made. So only drugs are allowed to make a claim, no, that it can treat or cure any specific condition. But as to the dietary supplements or food supplements, hindi nila pwedeng gawin yun. So they can only claim that it has an effect on the specific functioning of the body. Then the most important thing for us to remember is that the following statement is required on the product label. This product has not been evaluated by the FDA. It is not intended to diagnose, treat, cure, or prevent. In the Philippine setting, what we can read in the labels of our supplements is the quotation that says, ang produktong ito ay hindi gamot at hindi pwedeng gamiting panggamot sa anumang uri ng sakit. So, yan ang nakikita natin sa labels ng ating mga products. But before that, it is, hindi siya Tagalog. Ang nakalagay is no approved therapeutic claim. But this phrase, no approved therapeutic claim, it has been controversial kasi iba-iba yung pagkaintindi ng mga consumers, kaya minabuti na itagalog talaga siya, no? Okay, so then we also have the final rule for current good manufacturing practices, or CGMPs, for dietary supplements. So in this rule, manufacturers are required to evaluate for the identity, the purity, the strength, and the composition of their product. Then the German Federal Health Agency in 1978 established the Commission E. So the Commission E evaluates the safety and efficacy of herbs through clinical trials and cases published in scientific literature. So when we say clinical trials, so it involves the use in humans. So clinical trials are human trials. And there are 380 published monographs on herbs. So these monographs, 380, so herbs that are under this or with these monographs are the one that is accepted to be safe for human consumption. Now, let us have a very short review of the drugs coming from plants, no? So in the first page of your chapter, in the introduction, so it was said that many of the drugs available on the market are derived from plants, and some of these include aspirin, atropine, belladonna, capsaicin, cascara, colchicine, digoxin, and all the others that is mentioned or written in this slide, no? So let us try to discuss some. First, we have your aspirin, or known also as ASA, your acetyl salicylic acid. So it was discovered by or made by Bayer, no? So aspirin by Bayer. So aspirin is the shortened name for acetyl salicylic acid. So the letter A stands for acetyl. The spear is derived from the plant known as Spirea ulmaria, which yields salicin, and IN was a common suffix used for drugs at the time of the first stable synthesis of acetyl salicylic acid. So until now, we are using aspirin, no? As prophylaxis for those patients with heart conditions. Now, it is one of the first drugs to come into common usage, and it's still one of the most researched drugs in the world, with an estimated 700 to 1,000 clinical trials. Simply because it has been present, no, for a century, no, more than a century. So this is the plant, no, your white willow, and from this plant we can extract your salicin, no. Then also we have capsaicin. So it is a chili pepper extract with analgesic properties. So if you can see in the picture, yung ating sili, no? So it is a neuropeptide, your capsaicin, agent selective for primary sensory peripheral neurons. So if used topically, your capsaicin aids in controlling peripheral nerve pain. No. Now, this medication is also used to treat minor aches and pains of the muscles or the joints, like your arthritis, your backache, your sprains. And this capsaicin works by decreasing a certain natural substance in the body, your substance P, that helps pass pain signals to the brain. So that is your capsaicin. Then we have your atropine from your Atropa belladonna, commonly known as belladonna or deadly nightshade. So this is a perennial herbaceous plant in the nightshade family Solanaceae, which includes your tomatoes, your potatoes, and your eggplant or your aubergine. So the antidote for belladonna poisoning is physostigmine or pilocarpine. No? So the same as for atropine. So ang kanyang effect naman ito is mydriasis or mydriatic ang kanyang action. So this is the dilation of the pupils, and it can reduce salivation, bronchial secretions, and it has been used for mushroom poisoning. So that is your atropine. Then we have your digoxin or digoxin. So it can be pronounced either of the two, digoxin or digoxin. So lanoxin is the brand name. No, that is the name of the drug that we can find in the market. So it comes from the plant foxglove or your digitalis purpurea or your digitalis alba. No, alba is the white. No, so now ano yung digoxin? So it is derived from the leaves of the digitalis plant. So it helps make the heart beat stronger and the heart to have a more regular rhythm. So this is used in congestive heart failure. No? So treatment of congestive heart failure. Also, it can be used to treat atrial fibrillation. So ano itong atrial fibrillation? It is a heart rhythm disorder of the atria. So yan. But this is very potent. That is why if you read the label of this lanoxin, it comes in micrograms. No, micrograms lang siya. Then you have your Cascara sagrada, also known as buckthorn. No? So, yun ang pinaka-common yan, or the sacred bark. So, yan ang kanyang common name. So, it is a shrub, and what is used is the dried bark. No, the dried bark of the shrub is used to make the medicine. So this was approved by the U.S. Food Drug Administration to be used for constipation as an over-the-counter medicine. No, but there are questions over its safety. Now, high cost to conduct effectiveness and safety. So this is the reason, no, why it was removed or reformulated last November 2002. So today, it is now under dietary supplements. So pwede rin siyang gamitin as food flavoring or sunscreen. Then your Epicac. So it is the Brazil root, the Brazilian Epicac, the Calicoca epicacuanha, and all those other names, no? So it is used as an expectorant to thin the mucus and make coughing easier. Now, small doses also are used to improve the appetite, and it can be taken by mouth to cause vomiting after suspected poisoning. So, this is given so that a person na suspected of ingesting something poisonous will vomit whatever he has ingested. So, your Ipecac. Then your colchicine. So, from Colchicum autumnale or your autumn crocus, your meadow saffron. So, as you can see in the picture, so this is your colchicine anti-gout, no? So, this drug is made by the company Rhea, no? So, mga generics yung kanilang ginagawa ng Rhea. So, colchicine. So, ito ang ginagamit. Why? Why for gout? Because, tawag nito, it can relieve, no, the pain, no, in patients who are suffering from gout. Yes, this was your digoxin kanina. Sabi ko nga, the lanoxin is the brand, no, bland. So, 0.25 milligrams, so that is less than a milligram, so it's in microgram, no? So, yan. Then your ephedrine, your mahuang. Now, mahuang is dates back to Chinese. So, kasali ito sa mga Chinese medicine, no? Kaya lang, later, they found out that this mawang, the ephedra sinica, you can have or you can extract this compound. So, this was approved by the German Commission E to be used for cough or bronchitis. So, it can give temporary relief of shortness of breath, chest tightness, and wheezing due to bronchial asthma. So, it is a decongestant and bronchodilator. So, how does it work? By reducing the swelling and constricting blood vessels in the nasal passages and widening the lung airways. Okay, allowing you to breathe more easily. So, it is also often used to prevent low blood pressure during spinal anesthesia. But the problem with this mawang is meron siyang illegal use. So, some preparations include this mawang, this ephedrine, and then they label the product as a weight loss, for weight loss, no? Kaya yun siya ang problema. And this compound can be used in the synthesis of methamphetamine, and we all know methamphetamine is addictive. So yun lang ang nagiging problema sa drug na ito. Okay, this mawang. Then you have your ergotamine from ergot fungus, your Claviceps purpurea. So it is an alkaloid, no, alkaloid. So it is used in migraine with, usually we use it with caffeine, no. So yeah. So used in the early 16th century during childbirth. And it is also used to control postpartum bleeding kasi nga kapamilya siya ni some, I forgot, no. So when you say postpartum, that is the bleeding after childbirth. Okay, so pwede siya, binibigay siya para to prevent bleeding, no, after childbirth. Okay, so your Cafergot, that's the brand, no, from the Novartis company. Then of course your opium. So your Papaver somniferum, that is the scientific name of the plant, or your opium poppy. So from where we can extract opium. Okay, so we use the seed, no? So it is a drugs derived from this plant are called opiates. So you have your codeine and your thebaine. So common is your codeine. Usually codeine is included in cough preparation. So in the picture you can see Robitussin AC. So it is a suppressant, no? Cough suppressant expectorant. So ang pag may AC si Robitussin, meaning it has codeine. Kasi meron din naman tayong plain lang na Robitussin. This one is your opium tincture or your laudanum. So if you're familiar with the story of Romeo and Juliet, so this is the tincture that was taken by Romeo. No, by Juliet rather. So by taking it, so parang ano na si Juliet namatay. But in reality, hindi pa yun patay si Juliet, di ba? As you all know the story. So, it has a psychoactive effect, no? So, kaya nga, the only downside to this plant is that it is habit-forming or addictive. Kaya nga, if Robitussin AC can only be purchased if meron kang prescription. No? Hindi siya over-the-counter cough preparation. Then you have your physostigmine. So, this is used to treat glaucoma. So, also used as an antidote to organophosphorus poisoning and experimentally used to treat Alzheimer's disease. So, your Manzanilla de la Muerte, one of the most dangerous tree in the world. So, this is where it is being extracted. So, also known as beach apple. So, usually this is used for ophthalmic, ang physostigmine, no? So, kasi nga glaucoma. Then pilocarpine. So from Pilocarpus jaborandi, used to treat increased pressure inside the eye and dry mouth. Used for angle closure glaucoma until surgery can be performed. So ocular hypertension, so yung sa mata, open angle glaucoma, and to bring about constriction of the pupil following dilation. So that's your pilocarpine. Then your psyllium, your Plantago ovata, that's the name of the plant. So you have bland plantain, desert Indian wheat, bland psyllium, and isfago. So it is a soluble fiber derived from the seeds of Plantago ovata, an herb mainly grown in India. So this is one. So herb siya. So the husk is the main active ingredient in metamucil. So metamucil is also a kanang fiber supplement, no, used to reduce constipation. So because meron siyang excellent water solubility, so it can absorb water and become a thick viscous compound that resists digestion in the small intestine. So its resistance to digestion allows it to help also regulate high cholesterol, triglycerides, and blood sugar levels. It can also aid weight management and relieve diarrhea and constipation. Then you have your quinidine or quinidine from Cinchona officinalis. So it is an antiarrhythmic agent. And but the most common use of this one is for malaria. No use against malaria. But today, in malaria, we have multi-drug therapy. So noon, okay na si quinidine. No? Then your paclitaxel. So this is a newer kanang drug. So the tree, the Pacific yew tree or your Taxus brevifolia. So dyan galing si paclitaxel. So this drug is used as anti-neoplastic or cytotoxic. So meaning it is a drug used for the chemotherapy of cancer patients. So this is your paclitaxel, no, your Taxus brevifolia. Then you have your vinblastine and vincristine, so from the plant periwinkle. So this plant, you can see this, no? Meron nga tayo nito sa ating mga garden, different colors. May ito pink, may red, may white. No? So your Madagascar periwinkle or the rosy periwinkle or the Catharanthus roseus. So the name of the plant now is Catharanthus roseus, but before it was called Vinca rosea. No? Vinca rosea. So it is a five-petaled uh, flowers that come in range of hues from bright white or rich red, no, to pink and purples. Okay, so they are also the source of powerful cancer drugs, anti-cancer drugs, your vinblastine and your vincristine. Then your scopolamine, your hyoscyamus niger, your henbane, your nightshade. So I think you can see this one, yung parang bell. I forgot the name of this one in our in Filipino. No, katsubong, I'm not sure, but this one, no. So from this, you have your scopolamine. So, or known also now as hyoscine, no, hyoscine and butyl bromide. So that is your buscopan. So this is used to treat motion sickness and nausea and vomiting after operation. Also used before surgery to decrease saliva. So when used by injection, effects begin after 20 minutes and last for 8 hours. Then your serpin, your from the plant Rauwolfia serpentina or serpentine. So it is an Indian snake root or devil pepper. So it is a species of a flower in the milkweed family Apocynaceae. No, so it is used in the treatment of hypertension. So this one here, this is available still today. Your recipe. Okay, let us now go to the herbs considered unsafe for human consumption. And these herbs can be considered carcinogenic, hepatotoxic, or merong ibang effects or other effects. So now, carcinogenic herbs includes your borage, no? So your star flower. So in the Philippines, so it is used in the same manner as Trichodesma zelanicum or your dila-dila, no? So I don't know if you have seen this one, but I am not also sure if I have seen this because uh, minsan wala sa mga lugar natin, no? So, yan. So, carcinogenic siya, but it is used as a remedy for snake bites. Diuretic rin. So, we do an infusion of the leaves, cold infusion, no? Then, we can also crush the roots, make it into a decoction or infusion used for dysentery in children. But in the Indian traditional medicine, the decoction of roots is used for diarrhea, dysentery, and fever. Then you also have your comfrey, still carcinogenic plants, no? This one here. You can see this, meron tayong marami nito. So it is an ancient herb known since 400 BC, used by the Greeks to treat bronchial problems, wound healing and mending of broken bones. So the name comfrey is a corruption of confirma, the uniting of bones. So these are mga constituents niya. So antitussive, expectorant, and hemostatic, no? So it contains allantoin, no, which is attributes its wound healing properties, itong allantoin. Meron kang mga mga toothpaste na may allantoin, di ba? Okay, so yan. Then you have your Colt's foot, your Tussilago farfara, no, still carcinogenic. When we say carcinogenic, it has the capacity to cause cancer if taken in large amount. No? So yan, mga carcinogenic. And also your sassafras, your Cinnamomum mercadoi, okay, your kalingag tree. No, the part uses the bark and the leaves. Although they are considered carcinogenic, but still some people are using them. Lalo na mga passed down from one generation to the next generation. So, yun, ginagamit ka rin. Then, meron tayong hepatotoxic. So, when you say hepatotoxic, it is toxic to the liver. So, this includes your chaparral, your germander, your kava, and your live fruit. I think what's familiar with you, I think, is the kava, no? So, hepatotoxic implies that the drug can cause liver damage. So drug-induced liver injury can sometimes be brought about by acute or chronic use of um, the herb. No, now we have to remember that the liver plays a very important role in metabolism. No, in metabolism of all the things that we eat, all of the food that we have taken, the drugs and everything. So that is why it's very, very important, no, that the liver is functioning well. But again, there are some herbs that can cause toxicity to the liver. So this is your chaparral, no, this one. This is your germander. Hmm? So despite serious safety concerns, people still take germander for stomach and intestinal issues like weight loss, fever, yan. So ginagamit pa rin kahit na alam na medyo, kasi may risk siya. Hindi naman sinasabi na it will really, but there is a risk, no? Then your kava, your Piper methystico. So this one. Okay, so there are big safety concerns about kava. So because yun na nga, liver damage and even some deaths have been traced to the use of the kava. So it is banned from the being marketed in Europe and Canada, but I think in the Philippines it is still being used. Then your live fruit. So this is your plant. No, meron siyang volatile oil, your pyrrolizidine alkaloids. No, meron siyang tannins and resin. Okay. If in isolation, yung pyrrolizidine lang ang highly toxic to the liver. So, pero when mo extract this, usually pag ginamit mo siya as herbal supplement, ang nangyayari, you get all of this, tawag nito, components from the plants. Okay. Then there are also drugs that can cause pseudo-aldosteronism. So by the word pseudo, hindi talaga siya totoo, no, yung ganun. So ano ito siya? It is a medical condition that mimics hyperaldosteronism. It produces hypertension-associated condition with low plasma renin activity and metabolic alkalosis. Now, high doses of licorice. So the plant responsible for this one is your licorice, no? So it has been high doses of licorice for long periods may cause this aldosteronism, no? So yun, pag high dose, tapos matagal mong ginamit. So yun siya. Okay, so still this one. This is your licorice plant, no? Then there are your mawang, also known as ephedra, uh, yellow horse or yellow astringent can also cause myocardial infarction, strokes, or seizures. So yan. So ang traditional use niya sa Chinese traditional medicine is ito siya, no? So ginagamit talaga siya sa Chinese traditional medicine, no? So it was and still is used to induce perspiration and to treat the symptoms of bronchial asthma, colds, and influenza. No, mga Chinese drugs, meron pa rin sila nito. So this one. So, but we have to remember your mawang is contraindicated with your monoamine oxidase inhibitor drugs. No? So, usually, sabi ka natin kanina, ang kanyang indication is for weight loss. No? Usually, people use it for weight loss. Kaya lang minsan, mali ang pagkainom or taking other medication, that is why nagkakaroon ng drug interaction. So, yun ang mahirap pag merong Okay. So, ang use ng ephedrine, recreational drugs. So, yun ang problema. Kung sa asthma, okay lang. Kung sa weight loss, okay lang din as long na talagang kailangan magbawas ng timbang yung pasyente. Pero pag recreational drugs, yun ang nating nagiging problema. Then you have your poke root, no? So it is used as anti-rheumatic, anti-catarrhal, emetic and purgative. So ito ang inyong poke root. But we have to remember this plant is fatal in children. So your poke root, kasi nga may potential siya for toxicity. That is why fatal siya pag ginamit sa mga bata. But then again, there are no clinical studies on people using poke root. So may mga laboratory research that has shown that the saponins in poke root have anti-inflammatory activity. So laboratory lang, so hindi natin na-try sa humans. Now, should it be taken while pregnant or during breastfeeding? So excess doses of poke root may harm the liver and the kidneys and do lasting and severe damage to the nervous system. So this is an herb that should only be prescribed by a qualified herbalist. No? So hindi natin pwede siyang gamitin lang. No? Dapat talaga yung somebody who has the expertise para sabihan tayo na okay, pwede mo siyang gamitin. Qualified herbalist. Okay. Now, we also have herbs, no, that are considered unsafe by the Food and Drug Administration. So marami yan from A to X ang nakalagay sa inyong chapter. No? So ang dami. So we have your arnica. No? So arnica can cause, bakit siya unsafe? No? Let us try to focus, bakit siya unsafe? So unsafe siya because it has, pwede, no? May risk siya to cause muscle paralysis and even death. No? So, although it has uses like for bleeding, bruising, swelling, and also for hair tonics and anti-dandruff preparations in perfumes and cosmetics, but then again, you have to consider the toxicity of the plant, no? Bakit siya unsafe? Ang plant naman nagiging unsafe siya for use kung toxic siya. Okay, so yeah, so these are all its indications. But again, it is unsafe because it is related to muscle paralysis or death na side effects. So this is your tincture, no? So tincture of arnica. So you know what a tincture is. So yan na nakalagay ito lang ang kanyang problema. Then you have your American mistletoe. So what we have to remember of this plant is that it is capable of causing seizures or coma. Then your bittersweet and deadly nightshade, no, which can cause cardiac toxicity. So something to do with the heart. So kung yung pasyente may heart condition, lalong magkakaroon ng tawag nito, risk, no? The risk is double. So yan. Okay. We also have your broom. So your broom from the plant Citisus scoparius can cause dehydration. Then you have your Lobelia inflata, which is used as an expectorant before, is now considered to be poisonous. No? Kasi nga, it can lead to coma, the use of it, and pag nag-coma ang pasyente, probability it can lead to death. Then you have your Jimson weed. No? So, ang Jimson weed naman is can cause hallucinations. No? So, yun ang kanyang it can cause hallucinations sa pasyente at meron siyang anticholinergic effects. Then your lily of the valley. So, kanya naman is cardiac toxicity kasi nga cardiac glycosides naman siya. Now, there is no evidence, scientific evidence, that lily of the valley has any effective medicinal uses for treating human diseases. So, hindi natin ma-prove, kaya better, hindi na lang siya gamitin. Then you have your mandrake or your May apple, your Mandragora officinarum. Now, ano naman si mandrake? It can cause severe gastrointestinal symptoms. Okay, kaya it is considered unsafe. Then you have your morning glory. So, ito siya, di ba maganda masyado ang kanyang kulay, no? So, from the Ipomeia, no, the genus of the flowering plant family, no? Marami siyang species and morning glory is just one, no? So, your kangkong, no, belongs to the Ipomeia na mga species. So, ano naman si morning glory ang kanyang downside? It can cause psychosis, no? Meaning the patient might appear like somebody who is psychotic, no? Then, of course, your periwinkle. So, di ba, gamit siya for cancer, but it is prone to renal and hepatotoxicity. So, the kidney and the liver are the ones that are being targeted by the compound. So, toxic siya doon ng mga organs. Then, your St. John's wort. Ang problema ng plant na ito is marami siyang drug interactions. So, yun ang problema. So, kung you are using this one and you are taking other medications, ang problema ngayon is magkakaroon ng drug interactions. So, you have to ask your doctor if pwede ba talaga, no? Just to be safe. Okay. Now, there are other uh, herbs mentioned in your chapter, no, na merong mga unsafe or considered unsafe because of its toxic effects, no? Like, meron kang, but, this is not so common. So, yung mga na-mention natin, yun lang talaga. But, still you have to know, no? Kasi nga, itong lahat ng na-mention dito, usually, ginagamit talaga siya as herbs, no? Preparations, no? Supplements. Kaya we have to know. Ano siya. Okay. Then we go to the commonly used herbs. So, commonly used. Ano yung mga common na ginagamit natin ng mga herbs, no? So we have your black cohosh, your Simicifuga racemosa. So it became a popular treatment for women's health issues in Europe in the mid-1950s. So since that time, black cohosh has commonly been used to treat symptoms of menopause. So for menopausal patients, no? So sa mga premenstrual syndromes, so PMS, or painful menstruation, weak and brittle bones, and many others. Okay, so yan si black cohosh. So this is the mechanism of actions of your black cohosh. So you just read through this one. Then, efficacy, no? Tapos, ito ang importante, drug interaction. So, ano ang kanyang ano? So, if you are using black cohosh and you are taking cisplatin, so the effect is that the effect of cisplatin may be reduced. So, tawag ito niyan, inhibitor, no? Magiging inhibitor siya ni cisplatin. So theoretically, black cohosh may interact with hepatotoxic drugs like your acetaminophen, your carbamazepine, and your isoniazid. So there was a case of a patient taking atorvastatin, which is a drug for hyperlipidemia, which developed significantly elevated liver functions after black cohosh was also given to the patient. So yung tumaas yung kanyang SGPT level, no? Kasi yun naman ang measurement sa liver function enzymes. Okay. So side effects of using black cohosh can range from intestinal problems like nausea, vomiting, and weight gain also is possible. It can also lead to liver toxicity. That is why we have to monitor the liver function test. Then large doses of black cohosh may cause dizziness, nausea, severe headaches, stiffness, and trembling limbs. But it does not seem to increase the risk of endometrial hyperplasia. Okay, so yun. Yun ang ating dapat tandaan with your black cohosh. Then you have your chaste tree berry, your Vitex agnus castus. So sa Commission A, ang kanyang indication is for disorders of the menstrual cycle, the breast swelling, and premenstrual symptoms. So yun ang kanyang condition, indications. So as to the mechanism of action, the chaste berry binds to dopamine receptors and inhibit the prolactin secretion. Okay. And also one of its ingredients binds to estrogen receptors. Kasi nga, we get a part of the plant. That part of the plant consists of different chemicals. Kaya nga, sinasabi one of its ingredients. So meaning, if we are going to look deeper into the content or the composition of the part of the tree, meron siyang linoleic acid. Ayun. And it also increases the production of your LH or luteinizing hormone, but inhibits your FSH, your follicle stimulating hormone. Okay, so that's your chasteberry tree. So contraindicated siya in pregnancy, lactation. So for those pregnant and lactating mothers, it must not be given. And for those with hormone-sensitive conditions. With regards to drug interaction, it may interact with medications that increase the dopaminergic activity, like your bromocriptine and levodopa. So theoretically, it may interact with medications that decrease dopaminergic activities, such as antipsychotics. It also interacts with hormone replacement therapy and oral contraceptives. So marami-rami din siyang drug interactions. Sa side effects naman, mild GI upset, skin rash, and irregular menstrual bleeding. So yan si chasteberry. We also have your garlic. So everyone knows garlic. So sinong hindi alam ng garlic? In Bisaya, we call it ahos, your allium sativum. Diba? So sa Commission E, ang indication ni garlic is that it supports dietary measures for the treatment of hyperlipoproteinemia and prevent age-related changes in the blood vessels or your arteriosclerosis. So it has its mechanism of action, efficacy, contraindication. So we have to use it with caution in diabetes. Because it may increase the release of insulin or enhance the response to insulin. So, maging anong tawag dito? Hypoglycemia ang magiging outcome. So, caution in pregnancy because it can cause abortion, no? May cause abortion. Caution in peptic ulcer disease and gastroesophageal reflux or mga GERD. Also used with caution in bleeding disorders. And if you're going to undertake surgery, so you are using an herb supplement with garlic, you have to discontinue it for 2 weeks prior to surgery because of the bleeding na pwede niyang i-cause. So, yan. Dapat tanggalin muna siya sa system para kung operahan na yung pasyente, hindi siya prone to bleeding. Now, your cranberry, meron kang cranberry. So, your Vaccinium macrocarpon. So, ang indication niya is recurrent UTI, urinary tract infection. So, mechanism of action, just go through that. So, ang efficacy naman niya is that, it has not been shown to be effective for treating an active urinary tract infection sa recurrent lang. Kumbaga, contraindication niya is nephrolithiasis. The cranberry juice also contains high amounts of salicylic acid and may trigger an allergic reaction in patients with an aspirin or asthma allergy. No? Also, sa ulcers and GERD, hindi siya pwede. And have to continue it using it for 2 weeks before surgery, kagaya ng garlic. Now, drug interaction, it increases vitamin B12 absorption. It has the potential to enhance elimination of renally excreted drugs by changing the urine pH. And your juice may interact with warfarin, no? Increasing the international normalized ratios. Ang effect niyan, magkakaroon ng bleeding. And it may inhibit your cytochrome P452C9. So drugs that are metabolized by your CYP2C9 include your amitriptyline and your diazepam. So what will be the effect if ma-inhibit niya si cytochrome P452C9? So wala na ngayong enzyme na mag-metabolize sa drugs. So the drugs will increase its, ma-prolong ang action ng drug sa katawan. So that will be the effect. Side effects includes nausea, vomiting, diarrhea, nephrolithiasis. Okay, so that is your cranberry juice. Now, there are also a lot of other herbs that are mentioned in your tawag nito, in your chapter, like your dongquai, your angelica sinensis, no? So this is used for still menstrual disorders, anemia, constipation, insomnia, rheumatism, neuralgia, and hypertension. So contraindicated siya for pregnancy and lactation. So diarrhea, hypotension, or during cold or flu, you cannot take it, and for breast cancer. With regards to drug interactions, your dongquai interacts with anticoagulants like your warfarin. And also it interacts with antihypertensive drugs. It will increase the effect of your antihypertensive drugs that will lead to hypotension. So yun. It can also interact with your hormone replacement therapy and oral contraceptives. As to the side effects, photodermatitis, and burping, flatulence, headache. No? And ito ang pinakaano na side effects. It may stimulate breast cancer cells ang dongquai. Kaya, be careful no, when using. Kaya nga, it's very important for us to know the content of what we are taking before we take it. So, that's your cranberry, no? Sa juice. Then you have your echinacea. So, nandun din yan. So, your feverfew. So, may mga ano sila. Your echinacea is for upper respiratory tract, no, and lower urinary tract. Yun ang kanyang Commission E indications. So, it is considered effective in the treatment of common cold and the prevention of common cold. In contraindicated siya in pregnancy, lactation. So, the same, no? Also for people with autoimmune diseases like tuberculosis, multiple sclerosis, HIV, AIDS, and lupus. As to the drug interaction, your echinacea induces and inhibits. So dalawa, it can be an inducer and inhibitor of your CYP3A4 enzyme. And we have to remember that this CYP3A4 enzyme is the enzyme that metabolizes a lot of our drugs and foods, no? Kaya you have to be also very careful, no, in taking. Then your feverfew, as I have mentioned also, for migraine headaches, no? Still, ang contraindication niya is pregnancy, lactation, and children below 2 years of age. Also contraindicated to individuals with allergies to chrysanthemums or ragweed, no, your feverfew. And for patients with bleeding disorders. It can interact with anticoagulants, increasing the risk of bleeding. As to the side effects, we have gastric discomfort on oral consumption and contact dermatitis or hypersensitivity reactions. Also, palpitations. So, ito ang medyo tawag nito, delikado, no, itong mga heart cardiovascular related side effects, no? Yan. Tapos meron siyang post-feverfew syndrome kasi if you discontinue using feverfew, it may produce muscle and joint stiffness and a cluster of nervous system reactions. So, rebound. So, treatment siya for migraine, but kung muundang ka, may kakaroon ka ng rebound migraine, anxiety, and insomnia. So, di na nung kakatulog. So, yan. Then you have your fish oil, your flaxseed, no, for diarrhea, constipation. If you are wondering, flaxseed, ang kanyang use for constipation, pwede rin siyang sa diarrhea. So, both ways pwede siya gamitin. So marami siyang gamit but it's not really kanang claimed or documented na yun talaga, no? Pwede rin siya sa diabetes, menopause, hypertension, hyperlipidemia, and coronary artery disease. Okay. So, contraindications, bleeding disorders, diabetes, and gastrointestinal obstruction, and hormone-sensitive cancers. Yeah. Then you have also their side effects and drug interactions. Garlic, we have discussed. Oh, ito, another one, your ginger. Your ginger is very common. Okay, your luya, no? So use siya for dyspepsia and prophylaxis of symptoms of travel sickness. So it promotes saliva and gastric juice secretion, which increases peristalsis in the tone of the intestinal muscle. So yun, si garlic, ginger. So I know everyone knows ginger, no? So kaya lang, contraindicated siya sa mga bleeding disorders. No? Contraindicated also for those with gallstone pain. For use in pregnancy of less than 17 weeks of gestation. Kasi nga, it can relax, uterine relaxant siya in low but in high doses, stimulant siya. No? Kaya, pwedeng mag-cause ng miscarriage or abortion. Also contraindicated in those with diabetes because it can lead to hypoglycemia. And for those with heart conditions, it may worsen because ginger has a positive inotropic activity. So, di ba, ang daming umiinom nito pa hindi alam na may mga ganito palang mga drug or precautions or contraindications. So, your ginger has drug interactions with calcium channel blockers. No? These calcium channel blockers, drugs used to treat hypertension. So if you use with ginger, ang tendency is magiging hypotensive ang pasyente. So lalong magbaba yung blood pressure. Problema na naman yun. For diabetes also, it can cause hypoglycemia. No? So yan. So ang side effects lang ni ginger is dermatitis, heartburn, and diarrhea. In your ginkgo biloba also we have. So, ito naman is something to do with the memory, di ba? May mga preparations tayo na may ginkgo biloba for memory enhancement. No? Yung mga ganyan. So, kasi nga, anong meron sa ginkgo? Meron siyang flavonoids. Na these flavonoids are the ones responsible for the effects. No? So, may antioxidant activity ang mga flavonoids. So, kayo nagkakaroon ng ganoong mga effects. Contraindications, precautions for so includes epilepsy, bleeding disorders, diabetes, infertility. So for those people na mayroong difficulty in conceiving, do not take ginkgo. So, bawal siya. Drug interactions, medyo marami rin, no? So it may potentiate the bleeding properties of antiplatelets or anticoagulants. Your aminoglycosides, it will increase ototoxicity or toxic to the ears, not something to do with hearing. Then your thiazide, your trazodone, anticonvulsants, and antidiabetic drugs. It can also affect your cytochrome P450 isoenzymes, ang dami. Side effects includes gastric disturbances, headache, dizziness, and vertigo. Then you have your ginseng. Tonic ang ginseng, no? Di ba? Ina-apply na siya uban sa ilahang mga alcoholic beverage na, so tonic siya. Pero contraindicated siya sa patients with hypertension, emotional, psychological imbalances. So that is why you have to be very careful. At saka ang dami rin yung drug interactions. And of course, side effects si ginseng. So, side effects, nervousness, excitation, insomnia. Kaya nga, hindi siya pwede sa mga people with psychological imbalances. And another side effects is inability to concentrate with long-term use. So, hindi siya maganda in short. No. Then you have your milk thistle. So, hindi ito masyado sa Philippines. Your saw palmetto, your St. John's wort, and your valerian. Okay. So, among these, your St. John's wort, I think you can see that in the labels of some of our dietary supplements, your St. John's wort, your Hypericum perforatum. So it is used in supportive treatment for anxiety and depression. So, yan. So, yan ang kanyang Commission E indication. Pero, contraindicated naman siya sa fair-skinned persons when exposed to bright sunlight kasi mag-darken ang skin. Also in pregnancy kasi it can cause abortion. It may cause abortion. Okay? Then, for those with psychiatric conditions like bipolar and schizophrenia, hindi mo siya pwede ibigay because it might exacerbate or magsamot, no, ang condition sa pasyente. Hindi rin siya pwede sa Alzheimer's because it can induce psychosis in persons with Alzheimer's disease. Now, for those with hypothyroidism, it can also increase thyroid-stimulating hormone. And sa anesthesia, St. John's wort may cause cardiovascular collapse. So, mahirap. No, kung it will interact with kunyari, binigay mo tapos undergo operation anesthesia and nandun pa siya sa hindi pa siya na-win sa body. So, probability is that cardiovascular collapse. So, mamatay ang pasyente. And also, hindi siya pwede ibigay sa infertility nga naman because it will inhibit the oocyte fertilization and it will alter sperm DNA. So, ito ang pinaka-problema. Hindi na magkaanak o baka iba na ang magiging anak. So, no, for that matter. Saka drug interactions, ang dami, no? Ang dami. So, you can just go through your notes with that. Food interactions, meron din siya. If you notice, all of the herbs that we have discussed, if you read the notes, walang nakalagay na food interactions except for this, except for this herb, which is your St. John's wort kasi may food interactions siya. Food interactions. Like foods containing tyramine, no, like cheese, beer, wine, and your yeast. Hindi siya pwede. And a lot also of side effects. So, elevated blood pressure, no? Then your hypomania or mania. So, yun ang medyo alarming, no, na mga side effects. And last in your notes is your valerian, no? For nervous disturbance of sleep, restlessness, no? Hindi makatulog. But if you're taking this, do not drive or perform tasks requiring alertness and coordination. Hindi siya pwede sa pregnancy and lactation and sa surgery because it will have an additive effect to anesthesia. So, ma-prolong ang anesthesia effect. Drug interactions with CNS depressants like your barbiturates, benzodiazepines, opiates, alcohol, or other sedatives. And it inhibits your cytochrome P453A4. And as to the side effects, madami-dami rin siyang side effects, no? Ang overheadaches and all those written in your notes. Okay. So those were the herbs commonly used, no? So now there are also other dietary supplements that are potentially safe. So you can go through your notes. Meron tayong chondroitin, coenzyme Q10, your glucosamine, and your melatonin. So there are a lot of tawag nito, mga preparations na merong chondroitin, coenzyme Q10, melatonin, and your glucosamine. So meron yan siya. Now, what do you have to remember with herbal medicines and nutritional supplements? First is that you have to understand that they are not drugs. No? They are not drugs. They are not standardized in their preparations. And then they are not to be used to treat, no, any form of condition. So, ang kanilang gamit is just supplement. Parang add-on. Okay, add-on. Now, we know that these supplements are good and they have also kanang contribution, no, to the functioning of the body. But we have to remember that anything in excess is not good. It may be toxic. And we have to understand that if we use supplements, we have to ask the physician if it is safe to use. Lalo na if a person, if a patient is taking a maintenance medication or taking other types of drugs, because what we do not want to happen is the drug interaction, no? So, and also another thing that you have to remember, if there is someone in your family that is taking food supplements and okay naman, there's nothing wrong naman about it. But the only thing is that people tend to take more than one dietary supplement. So, yun ang problema kasi inom sila nito, then meron silang nakita na ibang klaseng supplement, inom na naman sila. So, yun ang nagiging problema. Because if we take more than one or two kinds of supplements, doon nagkakaroon ng problema. Because we might not know na yung supplement A natin, meron ng ganitong component, tapos yung supplement B, meron din siyang ganitong component. So, if that component is present in both products, so ang natitake ng pasyente is more than the enough amount, no, allowed. So, yun ang nagiging problema besides the drug interaction. So, okay lang na isa, no? So, as pharmacists, you have to read your labels so that you know what is the content of this food and dietary supplements. Okay, so I think that would be all, and thank you for listening.